1 million lives lost in the U.S. during this COVID pandemic, and the real death toll could be higher. In the world's #1 economy and the so-called shining beacon of hope, why do ordinary people perish with little to no protection? Why haven't the country's safety protocols worked? Why is the healthcare industry booming while people suffer? Julie Atkins has worked in nursing for more than 30 years, but the overcrowded ICU at her hospital is something she has never experienced.
As soon as we move one out, it's going to be filled almost immediately for another patient. And so we have people going above and beyond, but they are exhausted, just exhausted.
Dr. Harbaksh Sangha of Missouri's Lake Regional Health works a 12 to 14-hour shift looking after COVID-19 patients.
People are burning out. The burnout is very real.
Nicole Atherton, a nurse at Singing River's Ocean Springs Hospital, not only suffers from physical fatigue, but her psychological burden has also been increasingly intolerable.
So to watch someone suffer for weeks, unable to eat, unable to drink, struggling for every breath, it changes you.
Making it worse has been the severe shortage of personal protective equipment, or PPE, that the U.S. has experienced since early 2020. Some have even had to rely on college graduation gowns for protection.
To hear these personal stories of people on the front lines that have nothing, that are begging for gowns, that are begging for any support that we can offer them and as fast as possible.
Qualified nurses! Hire more nurses!
Widespread stress and burnout, health and safety issues, depression and work-related post-traumatic stress disorder. As a result, nurses are quitting in droves all across the U.S., with 62% of hospitals reporting nurse vacancy rates higher than 7.5%. Rising demand and shrinking supply are forcing many U.S. hospitals to pay top dollar to get that much-needed help. If they can afford it, of course. The country's healthcare relies increasingly on travel nurses who can fill in when needed at a price, up to a whopping $5,000 or more a week. It weighs down on those hospitals that provide healthcare to the bulk of uninsured, low-income patients.
Temp staffing agencies means privatization of nursing workforce is happening. So private versus public. So it's going to draw even further wedge between the haves and have-nots, and in terms of access to healthcare.
And to add insult to injury, some U.S. hospitals have even been forced to ration healthcare provisions.
We have had situations in here with COVID, with people this critical, where 2 people start to go bad at once. And you have to decide which room you run to. It's a hard decision to make.
Healthcare rationing has always been a reality in the U.S., and it's de facto rationing when patients are discriminated against because they can't pay out-of-pocket costs or simply because they live in rural, remote communities. However, according to Kaiser Health News, some of the richest nonprofit hospital systems raked in millions in surplus in 2020 due to lopsided federal healthcare bailout grants, a recipe for disaster as richer hospitals got more and poorer got less. Resources have overall been limited and rationed. According to The Atlantic, within every social class and educational tier, Black, Hispanic, and Indigenous people died at higher rates than white people. Is this the society that claims that all men are created equal in its Declaration of Independence?